Okay.
So that's why now when you hear the interns are really going through it, I really feel for them.
Yeah.
Because it's not a joke. The work that they do in the hospital, and I say interns literally run hospitals.
Sure.
Yeah. So you can't come and tell them that this is the pay you want to give them, because no, I think that's just doing a disservice to them.
Hello, everyone. So, welcome to our 7th episode of Money Tales. And my next guest today is a very interesting young lady, also in the content creation space, like myself. And I'm sure you've met her. She's Dr. Hope. And I don't want to preempt anything. I want her to introduce herself and tell us a little bit about herself. And of course, thank you for being here.
So let me, when you say you're sure they've met me, let me not, put it out there. But I am Dr. Hope, and I'm a medical doctor by profession, a content creator on health-focused content, a health advocate, health enthusiast, recently digital activist. Maybe aspiring entrepreneur, but that one we'll talk another day. Yeah, and thank you for having me.
Oh, wow. Thank you so much. And yeah, I'm sure the reason I said I'm sure you know her is because, of course, at the time of shooting this, there was a lot of things going on in Kenya, and and there was a lot of digital activism going on at the time, July, August period. So yes, we know our very own digital activists. So yeah, thank you for being here. So like you said, you're a medical doctor,
Yes.
but like we were talking before, I know you're not a practicing medical doctor. So what do you do with yourself?
Okay. So I am a practicing medical doctor, just in a different way.
Oh, sorry.
Yeah. So let me break it down for you, because
Okay.
I think guys don't really understand.
Yes.
In medicine, so we have clinical medicine and we have non-clinical medicine. So clinical medicine is the guys who work in clinics, in hospitals. Like if you're sick, you'll go and see them. So they'll treat you, they'll diagnose you and manage you, etc. Then we have the non-clinical side. So the non-clinical side is quite diverse. It's what people know as public health, but it's not just public health. So there are other aspects to it. There's there's administration, there's strengthening of systems, there's community work, there's advocacy, there's health literacy. So there's so much to it. It's just that they don't really go to hospital or work from a clinic setting. Yes.
Wow. Okay. Interesting. So how did you, of course, decide to become a doctor?
Well, Grey's Anatomy. I joke. I think ER. Remember the series ER?
Yes.
I think
is your age showing?
Influenced me.
Is your age showing? Sorry.
Too soon. But I think ER influenced me just a bit, if anything. But for as long as I can remember, I've always wanted to be a doctor, like since primary school.
Wow.
I think initially the first thing I wanted to be was a pilot, but the heights, no. I'll enter the plane, but I'm not flying it. Yeah, so I wanted to be a doctor since I think mid to late primary, then high school. I really wanted to be an obstetrician. Like my friends know, they still tell me, you're the one who's going to deliver our babies. But I said, you know what? After internship, I was like, no guys, please, I'll refer you, but it's just not for me. Then after med school, so I went for internship. Then internship is, I think you've seen the interns who are striking to be placed.
Yes.
Yeah, so internship is a mandatory 1-year training that we have to go through before you're actually a licensed doctor.
Oh, wow.
Yeah. So they can't practice without the license.
It's a big deal.
Yeah, because imagine them sitting home for 2 years with no direction.
Oh, wow.
Yeah, and they can't do anything in terms related to like now their medical practice. They can't do anything. Yeah, so I went for internship. And then during internship is when I think it just was solidified for me that clinical practice is not my main.
It's not your portion.
It's not my portion. Like I enjoyed it for a fact. I love talking to patients. I love engaging with them. But I just felt like, I think there's more. And I actually felt that because I dealt with a lot of old patients and many elderly patients are dealing with chronic conditions. And many of them didn't even know like their condition. You ask them, so what are you being treated for? They don't know. They just say they take medication every day. Sometimes they forget. And for me, that lack of health literacy is now what inspired me to kind of... Yes, yeah. Because I was just like, imagine the more you know, the more you're able to do. And for us as doctors, it's easier for you to manage someone when they know what you're managing. Because imagine how much you can contribute to the management when you're at home, when you're away. Yeah.
Okay.
So that's how even now the content started. Because I just used to film in my car, like at work. I used to work in Mashinani. Mashinani is the village. It's so nice. Let me tell you, if you can get a chance to live outside Nairobi, please do it.
Actually, that's what I wanted to ask you. Did you get an internship within Nairobi or outside?
No, I got outside Nairobi. So I was in Karatina.
Oh,
yes.
Wow.
Yeah, I was in Karatina. Yeah.
How was that?
It was not really a culture shock, but let me say, a culture shock from a linguistic aspect, because now there's language barrier.
Oh dear.
But at the same time, you still have to manage the patients, you still have to treat them. So yeah, that was like the only hard thing. And me, I'm not a linguist, but I struggle learning languages. I was there for almost 3 years, and I think I can name just 10 words.
3 years.
Yeah,
oh my goodness.
Almost 3 years. Yeah. So it was nice. It was different. It's slow. When people say Nairobi is fast, it's not a joke.
Yeah.
Nairobi is so fast-paced, and people out there take their time. It's slow. They enjoy the moment. You breathe in the fresh air, things like that. And just seeing people eat from farm to table.
Wow.
Your neighbor is the person who delivers your milk. Like, it was such a different view of how to live for me.
Yeah.
And it was so affordable.
Yes.
So I would say it was a very good experience.
And what did that do to your social life? Did you have to keep commuting to Nairobi to be with your friends, or you built a community there?
Okay, of course you build a community there with your colleagues, because you're there most of the time.
Yeah.
I would come to Nairobi. Okay, so during internship, of course, we were many, because me and a few friends, we decided to go to the same region.
Okay.
Yeah. So we many would visit each other, and that was nice in terms of our social aspect. But now, after the 1 year, everyone goes their own way.
Oh, yeah.
Yes. So now I stayed because I was retained, but now other people went, different ways. So the number of people you can visit has reduced.
Sure.
So now my social meter, it shrunk.
Yeah.
The weekends, I'd stay in the house the whole weekend. From Friday, I leave the house on Monday going to work.
Oh dear.
Yeah. So I think I sort of became an introvert, of which I wouldn't say I am. I think I'm an ambivert. Some would say extrovert, but I disagree. But
in certain situations.
Yeah, in certain situations. But yeah, I think it made me very introverted. Yeah. So now coming back to Nairobi, I had to learn how to socialize again.
Oh dear.
Yeah.
Okay. And I mean, now we know that internships the medical interns specifically, have a challenge with pay at the moment. So was it the same with you guys? Do you feel like you are not fairly remunerated, or, given that you're in Mashinani, it made do, or what are you, how did you feel about the pay at the time?
Honestly, I think...
And if you can give a range.
I can. I think for us, especially for my year, we're not the best people to speak, because as we had it sweet, by the way.
Oh, really?
Yeah. So what happened was, when we're still in med school, I think it was 2016 or 2017, there was the strike, the national health strike, where the doctors, we were asking for the CBA to be reviewed and signed.
Okay.
So it was. And from there on, now intern's pay increased. So I think before that, an intern was getting like, let me say 40, I think. Because like the older guys are like, you guys know what we went through. I was like, thank you for fighting for us. But seriously relates us. But yeah, for them, it was quite low.
Yeah.
And so it was actually, I think it was hard to sustain yourself when you're away.
Yeah.
But now for us, when we joined internship, the year was so smooth. So let me say, it almost tripled.
What?
Yeah, because of the CBA. So that at that moment, that felt like fair remuneration.
Yes.
I think for the work, still it's not, because you're literally a slave. Let me not lie. You're a slave in the hospital. So it might not feel like it's enough, but it was a big step for us. Yeah. So throughout the year for us, because I was 2019, 2020 there, the ministry was quite good. Quite good. Like, for me, honestly.
So sweet.
Yeah, I wouldn't say I'm God's favorite, but I started internship in January and finished in December. No single delay.
Oh.
From January to January, I was paid.
Wow.
Yeah.
Okay.
So that's why now when you hear the interns are really going through it, I really feel for them.
Yeah.
Because it's not a joke. The work that they do in the hospital, and I say interns literally run hospitals.
Sure.
Yeah. So you can't come and tell them that this is the pay you want to give them, because no, I think that's just doing a disservice to them. So I don't know what has changed, because I know they were given their letters, but I don't know what the pay is at the moment.
Okay.
But I really hope it's either what we're getting or higher, but not lower.
Okay.
Yeah.
Had they lowered it, or?
Initially, remember, not even last year, I think it was this year, when they wanted to slash it by half. So they wanted to pay interns 70.
Oh my.
And it's not 70 at net.
Oh
it's 70
my.
gross. Yeah. Even that photo I was talking about, it's gross. It's not net. Yeah.
Are you kidding?
Yes.
What? With the amount of work they do.
Yeah. So it actually feels like a slap in the face.
Yeah. Okay. And for the aspiring doctors who, of course, now have to go through the internship, what was it on the ground? Like, how was it for you guys? The workload? Everything. If whatever you can share, tell us, what should they expect on the ground, especially the ones waiting to be posted?
Again, maybe I'm God's favorite. Okay, I joke. No, maybe I am for real. But I went to a faith-based institution. And so there are different types of hospitals you can go to. There's the faith-based institutions, which is the ones run by the church or church-led organizations. Then there's county. Then there's private. So like Aga Khan has, I think, is it Aga Khan or Mpisha? But they take like one person. So
doesn't count.
It may not count, yeah. But now like for county, you're the doctor, you're everything. Yeah. So for them, the workload, of course, tends to be significantly more than other facilities. Not to say that other facilities don't have a lot of work, but county, I think you just know how the government works.
Yes.
Yeah. So for them, it was a lot.
Yeah.
It was a lot. And it's like you had to have this arrangement with your colleagues where you're just like, okay, fine, guys, we need to make this work. We need to ensure you've rested. I've rested. So let me sacrifice and do maybe 24 hours or 72 hours or a week for some people. And then the next week you're off, then another person comes and picks up. Like you just had to have your own arrangements. Yeah. So county can be a bit challenging, but it's a very good learning place because, most people go to the county for treatment, especially in the peripheries, because that's what they can afford. Yeah. And then also what I would say is go with people. Please don't go to a place where you're alone. Yeah, you will suffer.
Oh dear.
You will suffer.
Oh, like you collude with, like, okay, not collude, but like you agree that you're going together.
Go with people. Go with people, yeah.
Okay.
Yeah.
Oh,
it'll be fun, but also at least you have some support. Yeah.
Okay, fair enough. And back to your background a little bit. So do you think that your education, like you had to be like super smart to do medicine rather, you had to be like a champion of cramming? Like what are the real, nitty-gritties that helped with, secure that degree? Because of course everybody knows it's not an easy one. Yeah. Do you need to be like really book smart? I mean, in comparison also to some of your colleagues, what you saw them experience, what really helped you guys be successful and actually pass and become, medical doctors?
Okay. I think it starts from high school and especially, okay, I think it goes without saying that I don't think you have to be like exceptionally smart, but high grades are mandatory to get into medical school. So you can cram and pass your exams. You can just, be a photographic person who you just look at the book like this and the information is in your head. They exist, by the way. They exist.
Yeah.
And I don't know, it depends on how you assimilate information, but I don't think you have to be exceptionally smart.
Yeah.
Because I think, engineers are so smart. I'm so sorry, but I think there's so many people who are so smart. But I think it's just a sort of discipline that you need to have because med school it's grueling.
Okay.
So you have to be book smart. And book smart in the sense that you have to read.
Okay.
Yeah, you have to constantly read. So once you pass your high school, you have to pass with high grades just because I think there are normally so many people who want to get into the degree.
Yes.
So the cutoff is so high. So you have to start from there. Then when you get into med school now, it's a readjustment.
Okay.
Because now it's self-learning. High school, it's very guided, but med school is self-learning. So you have to motivate yourself.
Yeah.
Yeah. And you think that, oh my gosh, I was number one in my school. I was the smartest. You think if you come to med school, it'll continue. My friend.
Totally different
Let me tell
saga.
you, the way you fight for that 50%.
Oh my.
You fight for it with your life, by the way. And when you get 50 or 51, you're like, yeah.
A win is a win.
Me, I've made it. A win is a win. I don't care what the rest of you say, a win is a win.
Yeah.
So it's different. And I think for me, it was such a shock seeing, let me say, top of the top, but struggling.
Oh, yes.
Struggling.
Yes.
Because they make it so hard.
Okay.
Yeah. But constant cheating. And I think also having, group work, group discussions, that will take you so far because there's only so much you can do on your own, to be honest. Yeah.
Okay.
So I think that is very necessary for passing. And then, then you go to internship.
Okay.
Yeah.
Okay. And do you also agree that you guys are a bit, is it you're not many? What's the word?
Oh,
Like you
yeah,
guys
we're
are not,
understaffed.
you're understaffed,
Yeah,
exactly.
for sure.
You're understaffed in the hospitals, and generally also the number of doctors in Kenya
Yes.
are relatively lower than how many we need in the country, something like that.
Yeah.
And given that also many are still going outside as well. Yeah.
So we are very few for our population. We're at 50 million, and I think we are under 14,000 doctors currently as we speak. And the registry includes dead doctors, includes non-practicing doctors, doctors who've relocated. So the number is even smaller than that. And this small number is supposed to cater for the 50 million. So yes, we are significantly understaffed, but also at the same time, even if we had enough staff, the question is, do we have the systems in place to be able to enable this enough staff to do their job and do their job efficiently?
True.
Yeah.
True.
So I usually say that when it comes to health, there are so many building blocks and you can't fix one and say, yeah, we've fixed everything.
Okay.
So yeah.
It's a lot.
It's a lot.
Yeah.
Yeah.
Okay, then let's talk about your pivoting then. Now we are done with the clinical stuff. Now we are pivoting. We've pivoted to this other side of medicine. How has that journey been for you?
I think for me, it was initially at the beginning, because my last year of clinical work, I already knew like I want to transition. So I was just trying to reach out to like friends and like people I know to see like what are the best ways to transition.
Okay.
And luckily I had a friend who was working at some place, and she knew what I did, and it was social media related, health education. And she was like, for the program that we want to build, I think you would be a good fit.
Okay.
So I was like, Sawa, if you guys are, looking for someone anytime soon, like let me know, I'm here. So that's how I actually made the transition. So networking.
Okay.
But that's not the only thing. So what I've learned is you have to keep improving your skills. Yeah. Capacity building is so important for yourself, because remember now everyone has a degree, everyone has a master's. Like what makes you different? What makes you stand out? So yes, you might feel like, oh, I've done this in this sector. I'm a doctor, I'm this and that. So I should get, the next thing so easily. But it doesn't work like that. So you really have to keep building yourself. You have to keep putting yourself out there. Let me tell you, guy, networking. That thing called networking.
I know, the monkey that is networking.
You feel like telling people, see me, pick me, choose me, please. Like you can't say, I'm here, you can't see me. But I think it's been such a learning curve, because for us in med school, you come out of med school thinking, this here is the job. Like you finish, you're given the job like this. It's handed on your lap. It used to happen like that.
Okay.
Yeah, but okay, not exactly like that, but it was easier to get placements.
Okay.
But now it's so hard, and you find that there's so many unemployed doctors. So people have to start thinking outside the box. Yeah. In fact, Dr. Mokira, shout out to you. She says there's no box. Yeah. You have to just honestly think outside. Yeah. But also school. So for a lot of non-clinical work, school is very important. Okay.
Yes.
Your employers, organizations really value how educated you are, how experienced you are, and your skills and your capacity. And one of those things is, how educated are you?
Yeah.
So school is also a very, very important thing. And when you're pivoting now, you'll go out of non-clinical. So most people do public health, global health, health system management. What else? Like there are a number of things that you can do.
Yes.
Okay.
So
yeah, that has been the pivoting journey. And then also content creation. Honestly, for me, this thing was actually fun.
Yes.
Not fun, but in the sense that
for vibes.
For vibes. And I just wanted, like, let's say it's you, Babs. I just wanted you to learn something. Just you.
Yeah.
But then people started like picking it up and enjoying and asking questions, requesting for topics. And then, of course, your friends are just like, you can do this thing. Like, don't stop. Like, just keep doing it. Keep doing it. And normally I'm just like, guys, sometimes it's just for fun. Like me, I literally just do it for fun because it brings me so much joy.
Yeah.
Yeah. In fact, some people are like, you should become like a teacher or a lecturer or something like that. And I'm just like, I love teaching.
Yeah.
And I think it translates that way.
True.
Yeah. So I like how it's been accepted.
Yes.
And I like how people are literally taking the information for what it is and doing it. There's listening just to listen.
Yeah.
But there's also listening to do.
The relatability of your content. Yeah. So when did you actually start? Because, okay, for me, I think I followed you on TikTok from the beginning, but I only saw it last year.
I joined TikTok last year.
Yes, I started with you from the beginning. I remember, but from clearly the way you're talking, it wasn't your first rodeo.
I started on Instagram.
Okay,
and I started in 2022. Now, because now the patients that I was getting,
yes,
and I was just like, I think, as a doctor, you think this information is common knowledge, but it's actually not. So I'd really get so frustrated when I find my patients don't even, like, what medication are you on? I don't know. Here, pill, yeah, orange. That pill that's yellow.
Yeah.
I'm like, okay, no. Because what if you have 2 pills that are yellow, orange, So that used to not bug me, but I just used to feel like, no, I think we need to do better. And honestly, as doctors as well, our role is to educate.
Sure.
Yeah. And I have a friend who taught me something, and she always says this: aim to leave the patient better than you found them.
I agree. Yeah.
So even if you came today and maybe you had a flu and I didn't, give you medication, at least I equipped you with information, with knowledge of how to take care of this maybe the next time and even when you go home,
Okay.
Yeah, so that's how it started. And I just started on Instagram.
Okay.
Yeah, at the back of my car. Maybe now I've moved to the front.
That's the upgrade. The change.
Yeah. No, actually, I started in my house. Yeah, I started in my house before I got a car. I started in my house. And then now when I got the car, because I had a lot of free time, like in the afternoons, because most people go to like the hospital in the morning.
Yeah.
So afternoons you kind of have free time, but you can't leave. So I just go to the car and just talk about something. Like if it's something I've seen today in the clinic or I've seen on socials, I just talk about it.
Yeah.
So people started asking questions, they started relating, started following. So I was just like, okay, let me continue.
Yeah.
So this year is when I was just like, no, for real, let me try and take it seriously. And taking it seriously doesn't mean, like for me, I tell people, I'm not necessarily looking for numbers. It's just the consistency.
Yes.
Yeah.
Yes.
And my mom keeps telling me that, Hope, people have different roles. So like on social media, my role might not be to get the largest following, but to impact one person each day.
Right?
Yeah. So she was even like, the people pray for like, oh, what do you want me to pray for today? So she was just like, I think how you should be praying is that whatever you put out, may it reach the person it's supposed to reach.
That's actually a good one.
Yeah. So I was just like, okay. So let me just keep being consistent and it will help someone.
Yes.
Yeah.
Yes. Okay. No, that's a really good one. And I feel like your Instagram blew up this year, but before it was like just relatively, Instagram. It can be really, Instagram can be really, Yeah. But now like you recently blew up. How has that been for you now?
I think, that Mandamano thing was just so funny because it's not even me. That wasn't my strategy. I was just like, let me write down what I'm going to do. I can't remember her name, but there's a girl who before, like a day before, like each Mandaman or something like that, she'd tell me, hi doc, I think you should talk about this because I saw this happening on the streets and I think we'd benefit. So I was just like, okay, fine, I think I'll talk about it. So I spoke. Now that's the first post I posted about how to take care of yourself on the streets,
Yes.
So
and
that
it went
really
viral,
blew up.
Yeah.
And I was like, okay. And I, when you keep seeing, you're refreshing and you're just like, the notifications are still coming in. And for me, that was a bit, it was not rubbing my anxiety in the right way.
Oh dear.
Because I was just like, oh my God, this is a lot. But it was nice because I think it was relevant for people at the time. And you got what you were supposed to pick from that. And hopefully it helped you on the streets.
Yeah.
Then before now the Mandamano day was done, she came back again. She said, Doc, what I found out the first time I went out was hard to calm down. So tell people how to calm down from Mandamano, like how to work on, your mental health, to decompress.
Yes.
So I was like, okay, you're a strategist over here.
Yeah.
So I shared something as well. It was well received. Then I think now before the Tuesday that we don't want to talk about.
Yeah.
So I shared again, and I think now it was more focused on like first aid.
Yeah.
And it still did so well. And then so anything Mandamano related was really doing well.
Up,
Yeah. Because I think it was just really relevant.
At the time,
yeah. So that was nice, but I think it was also scary because now you feel like you have to maintain 1 million views. And I was just like, honestly, I'm not used to 1 million views. And to be honest, people don't eat health up the way they eat, other things. Maybe it's fashion, maybe it's, like that. Yeah, entertainment.
Comedy,
yeah. So I was I had this thing where I'm just like, guy, now you have to maintain those numbers.
Yeah.
But then I just told myself, like, listen, you're here to serve, even if it's one person. So don't think about the numbers, don't think about the views. Like, you just keep doing what you're doing.
Yeah.
Someone will see it, it helps them. And so that's how I've continued.
Yeah.
It's a high and then it's a low.
Yes.
It's a really high like this, and not at least it's high like this.
Peaks and dips.
And then a low, and then a low like that. And I think as content creators, that's something that people need to talk about.
We need to normalize. It's true.
So yeah, that was Mandamano. But also before Mandamano, there was the vaccination story.
Yes, you did.
Yeah,
talk about
so that one also went, and then it was on BNN, and I don't follow BNN, but also some of the stories that they post are not my cup of tea.
Sure.
So I felt some type of way when they posted me on their page. I was just like, hey. I was like,
okay, you're getting public, you're being made public.
Yeah, and how things can be misconstrued.
Sure.
Yeah, so now when things started going like viral in that sense is when I was just like, guy, am I sure I really want these numbers or these views? Yeah. But then at the end of the day, I was just like, you be true to yourself, do what you do best, and keep it pushing.
Yeah. No, it's true. And do you think your audience as well in TikTok and Instagram are very different, or it's more or less the same?
Extremely different.
Okay.
So I think people consume and internalize information more on Instagram.
Okay.
They actually take the time. I think for TikTok, we mostly use it for passing. And why is because of how the app started. It started as very, very short form content. So now when you come posting longer videos, of course, it's going to be hard for you to kind of find an audience because many people come to TikTok to scroll, So the audience is different, but it's still there. And also on TikTok is where people engage more. So people ask more questions.
Really?
Yeah, or people give more of their experiences. Or this happened to me. Like the topic on the hot water bottle.
Yes.
I was like, guy, I'm so sorry to all of us who've been burnt. But what? Yeah, so I think TikTok is also good for engaging with people.
Yeah.
Yes.
And your demographic? My
demographic is, so this is what Instagram tells me.
Yeah. You don't trust the data?
No, actually, and I know it for a fact. So my highest viewing audience, or my highest viewership is between the females, between the ages of 24 and 40.
Oh,
yeah.
Okay.
Followed by 16 to 24.
Interesting.
Yeah.
Interesting.
And then the rest.
The rest.
Yeah.
And TikTok is different or the same?
Honestly, I haven't looked at TikTok like that.
Okay.
But I think TikTok is so mixed. And why it's so mixed is because, people don't follow you.
They just watch, consume your content, but they don't follow.
Yeah, they don't follow you. So, but I'll check and see.
Yeah.
But I think it should be similar.
Yeah. And don't you think as medical content creator, like content creator around the medical space, it's a bit difficult? Like you said, people consume social media for entertainment, for But for you now, you're bringing education, serious topics. Girl. And you have a purpose with your content.
Yeah.
How has that been, given that I see sometimes you also do a bit of lifestyle? How do you balance your niches and all that?
Okay. I think for me, the thing is just stay true to yourself, because what I was trying to dispel is this whole narrative that a doctor is behind a white lab coat, behind a desk in a room. Like, we are human beings like you. Yeah. Even me, when I tell you exercise, eat well, even me, I'm struggling. Like, for real, I'm trying. The way I struggle waking up in the morning, we're going for a walk today, I struggle with the same things. Yeah. So I think it makes more sense to make myself relatable and just show what my life actually is, because it's easier to relate to that than relating to someone who is always behind the white lab coat. Not to say that people who produce content with their lab coats or with their scrubs are not. It's just that I just wanted it to be different, because I wanted you to relate to me as Hope, not as Dr. Hope, but as Hope. It's just that I happen to be a doctor and I can share some of this information with you. Yeah. So my life. And for the recaps.
Okay, I do like the recaps. And actually, very few content creators do the recaps as well as you guys do.
Oh, thank you.
Yeah, it's really nice.
It's so fun. Honestly, in this life, imagine you must have fun.
Yeah.
Yeah. So people say if you can find work that doesn't feel like work and you enjoy doing what you're doing, keep at it.
Yeah.
At some point, if it can make money for you, oh my goodness. you've hit the jackpot.
Yeah.
You know. So yeah, for me, I'm just like, just be true to yourself. Like, I'm not going to hide or, yeah. And also I like I'm addicted to shopping. So I have a problem.
We know. It's a very expensive
hopefully I will
hobby.
learn today. I have a problem. But it's nice how you guys eat up my, let me say, nonsense. Yeah.
Okay.
So yeah.
So do you make money yet from content, do you think? Or do you want to share? Sorry.
I don't mind sharing. Yes, I do. Not like the bulk of it, but yes, I make some money from it.
Money,
yeah. And what I'm very keen to tell, like even anyone who approaches me is, listen, I'm a doctor first, then the person. So I don't push numbers, but I push information.
Correct.
Yeah. So of course with that it's harder to find, people who are willing to pay you. There's some companies or some organizations that are starting to think in that sense that, if I equip you, you get the understanding and you'll remember you got it from me. So you'll keep coming back to me. So there's that's how you think about strategy. But for me, I just make it clear first and foremost, I am a doctor and my work here is to educate, or rather that's what I purposed my work to be here, to educate. So whatever I'm doing, especially if it's health related, it must educate. Yeah. There are other forms of work that, like if I'm working with a company that what sells shoes, I like shoes. So that's okay. Like there, I don't have to educate. But if I can find a way to put in educative content there, I will. But if it's supposed to be health focused, it must educate.
Yeah.
Yeah.
Are there brands who are in the medical or health space who reach out to doctors?
Yes.
Okay, I didn't know this. What would, for example, like what products would they want you to advertise? Don't tell me drugs.
Girl, skincare.
Oh,
First of all, we are not allowed to market medication.
I thought so.
Especially regulated medication. We're not allowed to market it.
Okay.
Yeah. But yeah, skincare.
Okay.
People market supplements. In case you guys didn't know, supplements are not categorized as medication. They're sold as foods. Yeah. So you're allowed to market supplements. What else? Someone can come to you and tell you, I want to sell an orthopedic shoe, an orthopedic mattress. Like there's so many companies.
Oh,
mosquito nets, mosquito repellent. Let me tell you everything. Health ties into almost everything. Yeah. Glasses.
Food. Oh,
yeah.
Okay.
Even your jewelry, because of contact dermatitis. Like there's just so many things.
Yeah.
Yeah.
And do you feel like you said, you're a doctor first. Do you feel like for you'd like to utilize a product or actually have a proper understanding of what they're offering before you share it?
Yeah.
And you're very, ethical about that. And you don't mess around.
For sure. Because remember, at the end of the day, your license can still be taken.
Oh dear.
At the end of the day.
Okay.
Yeah. Yeah. So it's very good to understand what works and what doesn't work, what would be considered as good conduct, what would be considered as misconduct.
Yeah.
Yeah.
Okay. Oh, we didn't know that. Ethical issues in medicine are serious.
Yeah, yeah, very serious. Like you don't even if you feel like we're not that strict when it comes to our regulations. You just don't want to be the one God will say, what shall we test with this one?
Yeah. Okay. And I feel like the way you've explained content creation, I feel like it's your passion project. Yeah, like it's really something you hold dear to your heart. Even though you smile. The way you're smiling about it.
Let me rephrase it. Health literacy.
Okay.
Yes.
True. Fair.
Yeah.
So what's your vision? Like vision for it? Like where should what should we expect from Dr. Hope in the near future? Where are we going with this?
I don't know what you should expect, but you will just keep hearing my voice.
You're not stopping.
It might be on a larger stage, a larger something, but you will keep hearing my voice.
Yeah.
Yeah.
I feel like, it could be something like even going into talks.
I did that.
Going into like having conversations in schools,
organizations. Because the youth, the youth are so undertapped, especially when it comes to health.
Yeah.
It's not even like the youth like over 20, but like between 14 to like 19.
Yes.
Yeah.
So high schools, Miss please call Dr. Hope for some conversation.
Mutanipata hapa.
Please call her to have conversations with some of the high schools. I think especially girls, we need a lot of information.
Yeah. But I like actually that there's a lot of talk, especially in women's health, in girls' health, the talk on menstrual. Like I just love it.
Yeah.
Yeah. And I know sometimes the boy child feels like they've been forgotten, but I keep reminding guys, these things are initiated by women. Like, we are the men to advocate for the boy
others,
child, you know.
Yeah,
especially when it comes to mental health. I'm like, men, listen, I'm addressing men. Which camera? I'm looking at the camera.
Yeah.
Men doctors, men leaders. Aki, please step up for the boy child. But I think there are things they need to know that can only come from men.
True.
Yeah.
I feel like they're doing woye, the man is being left behind, but they expect the woman to be the savior of the situation again.
And not even that. Yes, the woman can be the savior, but you know, sometimes your dad can tell you something and you're just like, what do you know? But your mom tells you and you're like, anyway, yeah, for real. Because maybe she has a lived experience. It's very hard for me to come and tell you as a man, what am I telling you as a man?
Yeah.
You know?
Yeah. Actually, speaking of mental health, maybe we can touch a little bit on it. Like, the way I feel like Kenyans right now are handling mental issues, do you feel like it's getting better? Do you feel like women are doing more for themselves to improve themselves? Especially like when now you are on the ground with the patients, right? How do you think mental health should be handled? Like in terms of, you know, self-improvement and self-awareness and going forward generally as Kenyans? Of course, we are not there, but...
We're not there, but I think the past 2 years, it's been good to see it being talked about more.
Yeah.
But that's just surface level. And I keep telling people that in health, things don't change in a day because what you have to do is change the mindset.
Yeah.
Because remember, you're influencing someone's health-seeking behaviors. And I won't change tomorrow because you say this and that. It'll take me some time. So we still need to keep talking about it, especially to the young people. We still need to keep making these avenues accessible because, yeah, I can talk about it, but it's not accessible to me.
Yeah.
If you think about it, there's only a certain percentage of people who can afford mental health care because it's not cheap.
Yeah.
And NHF, I don't think NHF covers it. Your insurance policy, even if private, might not cover it.
That's true.
So as well as we're talking about awareness, the accessibility aspect is also very important. We also need to think about that. How do we make these things accessible to people immediately when they need them, you know? Yeah. So I think we still have a very long way to go. And something that I don't know, I think it's just, I don't know if it's normal. I don't say normal.
Yeah.
But women just tend to have better health-seeking behaviors compared to men.
Yes.
So women tend to go look for the mental health specialist or go look for even the doctor. If you have a cold, go look for healthcare services.
Yeah.
So I think even for the men, and this is why I'm saying men need to step up and just not educate, but create awareness on health-seeking behaviors.
Yes.
Because like for me now in my practice, most of the men who would come, even with chronic conditions, you've come way too late.
Oh dear.
Yeah, for us to, we can manage it, but we can't like treat it and fix it. And if you came a few months earlier, we could have, you know, treated it and then we watch it, especially for like your cancers, for what else? Like the chronic conditions, hypertension, diabetes, they come when the complications are so far off that it's very hard for you to actually reverse them.
Yes.
Yeah. So now we need men to really speak for the young boys and also for the youth.
Yeah. And what advice do you have for the young people? Because I feel like now the young people also, I don't know if it's the way they've grown up, let's say Gen Z versus millennials versus Gen X. And we go along. I feel like the way they're able to handle life is much different than the rest. Gen X and below.
Yeah.
The way they handle life is much different than the millennials and the Gen X's. And life is lifing at the moment. And they're giving up much faster and things like that.
Yeah.
We see a lot of suicides of late. What can we do to help the younger people other than, of course, self-awareness and like what you're doing, education, some of the things we can help even yourself maybe as well?
Honestly, I think that stems from childhood. Like it's such a, and I don't say, it's not that there's bad parenting. It's just parenting styles have really changed. And now if you look at Gen X, if you look at us as millennials, growing up, it's this way or no other way.
Exactly.
So you just have to conform. So that's why we tend to do better in streamlined places. Like if you tell me jump here, I'll jump. But if you tell a Gen Z jump here, they'll ask why.
Yes.
You know, so for them, they've been brought up in a way that you can speak your mind, ask the questions. If you don't feel like doing anything, you know, have the discussion, have the conversation with the person. And what has happened is we are still having a transition of systems. So it hasn't changed 100%. So you'd find that these are Gen Z, but your bosses are Gen X.
Yes.
So you see, they're going to clash. And when a Gen Z hears no or not that way, them that's not how they were brought up. And it's not for all of them. It's just what I've observed. Yes. They're very vocal about what they want. They advocate for themselves. So if you're trying to confine them or put them in a box, they don't do well there.
True.
Then something else is, I don't want to, should I say it? You know, Gen Zs and kids these days are being brought up like you're the best. You're the best.
Okay.
You're a shining star. But at the same time, are we telling them the realities of life?
Okay.
When you come out, 500 of you have been told you're the best.
Facts.
500 of you have been told, oh my goodness, shining stars, all of you. So when you feel like you haven't made it, you feel like it's the end of the world. But that's not the reality.
True.
In life, and life is hard. Whether you like it or not, life is hard. It's just how you navigate through the situations in life. So we're not equipping them to be able to navigate through difficult situations. We are cushioning them and telling them that, oh, you're good. And it's true. They're good. They're the best. They're very, they can shine wherever. But it's also good to tell them the realities.
True.
Yeah.
True.
So I think for me, that's the difference. And what advice I'd give them is there's this sense of urgency where people feel like I need to achieve everything now. Yes. If I don't do it now, I'm a failure. Take your time. Enjoy the now. Rome was not built in a day. You will have a bad day, but that doesn't mean you'll have a bad life.
Yeah.
Yeah. So just take the time. Allow the bad seasons to come. Allow the good seasons to be there, because life is ups and downs like this.
Yeah.
Yeah. So also, if you don't have a good support system, if you don't have healthy coping mechanisms. Healthy. I said healthy. If I hear people saying they're drinking and that's a healthy, no.
That's it.
Healthy coping mechanisms that enable you to stay sane during that hard time, because it will come. For a fact, it will come. Yeah. So I think that's my advice to them.
Yeah. No, that's really good. I agree. Totally agree with that. Nothing else to add, by the way. So what are some of the money mistakes you've made over there?
How much time do we have?
And money lessons you'd like to share with our audience today, given that, we are assuming, but I think she earns good money. Of course, she'll not give us the numbers.
To God's ears.
People in your space earn well. We can presume.
Yes, people earn well.
Yeah.
People earn well. Yeah. But what I've noticed is people in this Nairobi earn well. It's people in this the cars I'm seeing on the roads. Hey,
let not Zakayo hear you, please. Yes.
No whisper, but the cars I'm seeing on the roads. Hey. Anyway, so I wouldn't say I've had like very many financial woes, and that's because I'm very conservative in terms of my, let me say, investment or my risk taking when it comes to financial things.
Yeah.
Let me take it back. Let me take you on my financial journey first of all.
Yes, please.
So growing up for us, finances are not things we talked about.
Okay.
Like, you'd go to school, you want this, you have that. Like, yes, you are comfortable. That was nice. But we never really had conversations around money. Then we get to now, internship. Because in high school, in med school, we were broke, poor. Like, I didn't have money. I can't lie. Anything you saw me having, I had sweated and not eaten for it. But now we get to internship. Now that's when you start earning properly.
Yeah.
And for us as doctors, you come out of med school so late in life, where other people have been working for a couple of years.
Yes.
But for us, you come from zero or rather for our year.
Okay.
Please, if you went to internship before me and after me and things have changed, this is me. This is me. So we came out of med school and then started internship. And then it's like you're getting 150K in a month. No one has told you about financial literacy.
Yeah.
No one has told you how to invest. No one has told you this and that about money.
Yeah.
So you're just thinking, guys, I'm a baller.
Yeah.
I have money.
I want my first car tomorrow.
Yeah. And that was people's mentality.
Yeah.
So it was such a, let me say, it was a culture shock. Because you're just like, me, I've gone from this to this, and it's a jump. It's literally a jump. Yeah, but honestly, for me, I'm a miser. Everyone knows that.
This beauty over here is a miser.
I'll explain why and how. I'm a miser. And the thing is, if you see me spending, I'm suffering somewhere else.
Okay, fair.
Like for me, honestly, food, why are we spending money on food?
Yeah.
Absolutely not. I can't starve. Why are we spending money on food? There's food in the house, Yeah, so that's like my struggle point. I really struggle eating out. So I'm just like, first of all, these Nairobi prices are crazy.
Yeah.
I struggle with eating out. But if you tell me to buy clothes, to buy shoes, to buy makeup, to buy wigs, I will buy. Listen, I will buy.
Yeah.
So that was like my balance.
Yes.
But also, for me, I'm very scared of not affording the lifestyle I want.
Yeah.
So I don't maximize my spending. I'll just do small here and there. And the things I buy, I rarely impulse shop.
Yeah.
I'll do it like once or twice, but the things I buy, most of the time, I've been looking at them. I'll be like, I'll come back. Especially if it's like costing me an arm and a leg.
Sure.
I'll come back. Yeah. So yeah, that was internship. Then of course, after that, now you start learning how to manage your finances and you know how to live within your means.
Yeah.
Then I started investing in 2021.
Okay.
Yeah, 2021. And the thing is, I'm not a risk taker, I told you. My risk appetite is quite low.
So what's in your portfolio then?
Quite low. Like I do a bit, some MMFs, government bonds. That's like, what else?
So land,
as of now, that's it. I don't have assets as you speak. Not yet. And my car is not an asset. That one is depreciating even. Yeah. But yes, land. I've been thinking about land, but I'm so scared of getting scammed.
Yes.
Yeah,
facts.
like honestly, but yes, land is something that I'd be interested in. And what is this thing? Stocks. But I'm so scared. And let me tell you why. Because once beaten, twice shy.
You bought stocks not
stocks. So what I did was I invested without understanding. And that's, guys, if there's one thing I'll tell about investment, please know what you're investing in. Understand before you throw your money somewhere.
Yeah.
So when I was buying my car, I had money that I wanted to just put away for a short period of time. Like it wasn't a big money.
Yeah.
So I was like, let it stay there for a short period of time. And it would be nice if it's earning some interest,
Yeah.
So I put it in, I bought T-bills.
Okay.
I put it there for 3 months. So after 3 months, I'm like, I know, I'm getting my money and some interest. You can go buy a pair of shoes or blah, blah, something. When the money checks in, I'm just like, I wanted to call the bank and be like, excuse me.
There's been an error.
I'm missing a balance. A significant balance.
Yeah.
And that's when I realized that the PA, it's still per annum.
Yes.
Regardless of how short you're putting the money.
Yeah.
I sat there like this. I was in bed.
Yeah.
It was a Saturday. I was still in quarantine. I sat there in bed like this, like, oh my goodness. Just mind boggling. What? I'm bamboozled.
I've been robbed.
Oh, but then now, of course, you realize that it's on me.
Yeah.
I didn't ask the questions.
Yeah.
It's on me. So after that, I was just like, listen, if I don't understand, I'm not investing. And the thing is, you don't have to invest now. Understand first. Take the time to educate yourself.
Yeah.
Then invest. Because you'll lose that money.
Yeah.
Mm.
Okay. Fair.
Yeah.
Okay, thank you for sharing. So my last question would be, what would you advise, or rather, what have you done now that your younger self probably would look at you and be like, thanks, Hopi, like that you got us here. What did you do in your past that got you here?
First of all, I finished med school.
Hongera.
It wasn't easy.
Yeah.
There's that because, when you keep saying something, I'll be a doctor. And then it happens. I was like, yeah.
I did that.
Okay, not I. God helps me do that.
True.
But yeah, I finished med school. But also prioritizing self. Me, I keep saying I'm a reforming people pleaser. I have not yet reformed kabisa, but I'm a reforming people pleaser.
Yeah.
And what I notice is I will break my back for everyone else apart from myself. Yeah. So that's something that I have changed, or rather I'm still working on to change, because you're your best asset. You're your best and biggest asset. So if you don't actually focus on you, at the end of the day, what are you doing?
Yeah.
Yeah.
Ooh, nice one.
Oh, I have one more, but financial.
Yes. Tell us.
So I said I'm a miser. I think I mentioned that, yeah?
Yes.
And because of that...
Which we don't believe, by the way, but okay.
It's true. Ask my sister. My sister will tell you. She's the one who knows.
Yeah.
She's my bank account. So I had this tendency, which has just changed this year, to be honest, of holding on to money.
Okay.
And just Ivy said that if you're holding on to it, you don't have space for more to come in.
That is very true.
And also, I realized if you're holding on to money, you're not giving it the potential to grow.
Exactly.
So I have just been learning to let go. And then there's this book I read. Okay, it's a nice Christian book. I don't know, for any Christian out there, it's called Financial Stewardship.
Okay.
And for me, I used to think that this is my hard-earned work. It's me. I've done it, everything. But at the end of the day, God is the source of everything good. That includes your money, your job, your everything.
Yeah.
So why are you holding on to it like it's yours? It's His.
Okay.
Let go.
Yeah.
Trust in Him to bring more.
Back. Yeah, more will come.
Exactly.
Yeah.
Money goes, money comes.
Yeah. Okay. Wow. Thank you.
Yeah.
Thank you for that. So, guys, it's a wrap. Thank you, Dr. Hope, for being
Thanks
here.
for having me.
Yeah. See you on the next one.
Bye.
Bye.
Kwanza those who are paying in commission.
Yeah, don't get
Your
me started
days
on those.
are numbered. I'm doing a video. It has over 500k views, and people have gone to your page and they've seen what you have. Probably you've gotten sales. But if someone has not used my code, I won't get anything. So I'm working. So they didn't use your code, so you're not getting anything. Make that make sense.
Yeah.
Watu wa commission nyinyi.
Mungu
Mungu vile anawaona.